See, I'm on mute. Got it. This meeting is being recorded.
Okay, so I'd like to thank you all for spending some time. I want to first, before I start answering questions, I want to just bring you up to date on the information that we know. Since the Alliance did their presentation just about a month ago, we came away from that with a number of questions that people had asked that we couldn't get answers from at the time. We've gotten answers on a lot of those, and that's what I want to share here. Hopefully you can see the screen. These were questions that came up during their presentation, and we went back and got answers for them.
No, they are nice chairs.
You should have all received this. You should have all.
Will you please mute yourself? Mute people.
Okay, I keep muting you guys. You gotta bear with me. Okay. Enough is enough. I said you can't unmute yourself, so now you got to rely on me to unmute you. So these were questions that popped up during the Alliance presentation. The first one had to deal with hospice care. The question was, are we still going to have 210 days of hospice care? The answer was there is unlimited hospice care with Medicare. And since it is a Medicare plan, we now will have unlimited hospice care. The 210-day limit that we're all thinking of is pre-Medicare. That's in the GHI CBP plan, the Empire Blue Cross portion. So there is no limit on hospice. Generally, if you're in hospice for more than 60, 90 days, somebody has misdiagnosed you, because it's generally designed to be for palliative or making you comfortable in your final days. And 210 days is 7 months. And so if you're in hospice for 7 months, then somebody has misdiagnosed you. The second part here, we just finally got a question. We finally got an answer on. The question was, will the prescription program participate in the insulin savings program? Unfortunately, Emblem in specific has replied that they will not be participating in the insulin savings program this year. They didn't do it for 2021, and they won't be in it for 2022. I can feel your pain. I'm diabetic. I use insulin. I know the cost, and it would be nice, and we will continue to push them to offer this in the future. The next one is a question I raised to them as well as some of our members, and that is, if a primary care doctor requests in-office tests, for example, an EKG, a sonogram, are they subject to a copayment? Every time I go to my primary care doctor / cardiologist, they give me an EKG, whether I need it or not. The last time I visited them was for a rash. They gave me an EKG. So anything that is done in the doctor's office, such as EKG, sonograms, are part of whatever copay you may be paying. So if you go to a specialist, a cardiologist, they do the EKG, that's not a separate $15. That's part of the same encounter visit. More importantly, when you get to the issue of blood tests, urine tests, those type of things, the copay is per encounter. So it's $15 for you to give a urine sample or for you to have blood drawn, not $15 from every test you go through. One of my doctors recently upgraded their medical record system, and every time they posted the results of one of the tests they did on the blood draw, I got an alert. And I'm adding up 8, 9, 10 of these. I'm saying that they're going to charge me $15 for every one. So the answer is no. It's just one for the blood draw, one for the collection of the sample, and then that's all. Then they run all the tests off of that. We specifically asked about members who have a spouse or partner who is covered by a New York State plan, New Jersey State plan, government retirees. Their interpretation is that these other plans are employer-sponsored Part D plans, not Advantage plans, and so you should be able to keep those plans and not run afoul of being in two different Advantage plans. Question was, what form was needed to opt out of the drug plan? If you want to opt out of the drug plan that comes with the MA plan, you need the regular health benefits application. That form is on our website, dsawf.org. And if you want to opt out, you fill that out, and we'll be willing to submit that to the city for you. They'll be overwhelmed with other opt-outs, and so this will help you make your intentions known to the city. With federal employee and TRICARE specifically, you can continue to use TRICARE. That will not be a problem. If you're in the Advantage plan and TRICARE, you won't have a problem. Generally, two government programs like this conflict, but TRICARE has been specifically carved out so that you can have TRICARE and be in the Advantage plan. And the last question we was asked was very specific, and it taught me something I never knew existed. So I figured let's put it in here. New York State has a health program for Native Americans, and one of our members is married to a participant in that plan, and as a result, had a question of how will this work, and there will be no impact. The spouse can stay in the Native American plan and be in Medicare Advantage, and there won't be a problem. So these are the questions, the big questions that came up. I'm going to now go to one other part here, which I hope you see. It's the what do you need to do if you want to opt out? You should have all by now received the pre-enrollment guide to opt out of senior care. That's the one that was mailed to 200,000 people. It's the most popular of the Medicare Advantage, Medicare supplemental plans the city offers. So that's why that was the one that was sent. A couple of weeks ago, they finally released a pre-enrollment guide and opt-out form for people who are in any other plan. Maybe you're in one of the Empire Medicare Advantage plans, or Aetna, or HIP, VIP. So there are two forms, one if you're in senior care, one if you're in something else. And both of those forms are on our website, csawf.org. The guidebooks are there as well for each one. And the places to send the opt-out form are there. We cannot in the fund accept these for you this time. They need to go through the Alliance. We'll send them to Labor Relations. When Labor Relations processes your opt-out, they will send you the confirmation. So, important. If you are Medicare eligible now and covered by the city, you or a partner or spouse, you will automatically be enrolled in the new Medicare Advantage plan unless you tell them otherwise, unless you opt out. If you are not yet Medicare eligible, your spouse is, then you need to opt the spouse out if that's your desire. The opt-out period, we're in it now. We've got another 31 days to go through this. So, you need to make sure that the opt-outs are in by October 31st, and the changes will take effect January 1st. All Medicare eligible retirees who don't want to be in the Advantage plan must opt out. HIP, whatever you may be, you need to opt out. Going forward, you say, okay, I'm going to opt out of senior care. I don't want to be a pioneer. Let somebody else work out the kinks. That's fine. If, as we expect, it's not as bad as everybody thinks it is, or is being led to believe it is, then next year, during the transfer period, you can then say, I want to switch out of senior care and I want to go into Medicare Advantage. And you'll be in effect able to do that effective January 1st of 2023. If on the other hand, you say, let me give Medicare Advantage a try, you realize during the year that it's really not for you, again, at the end of the year, at the end of 2022, in October, November, you will be able to switch from Medicare Advantage back to senior care and pay whatever the additional pension deduction is. If you need to add or drop the prescription drug benefit with senior care, again, you need to do the health benefits application and get it to the city by November 15th. I'll be more than happy to help anybody that needs to do this, to get the form to you, make sure we're doing the right thing, and make sure we get the form to the people in the city that can handle your request. If you or your spouse or partner turns 65 after October 31st, which is the end of the initial opt-out period, you'll be enrolled in the Medicare plan, the Medicare version of your health plan. So if you're currently in an Aetna plan, you'll be enrolled in the Aetna Medicare plan. If you're in GHI CBP, which most people are, you'll be enrolled in senior care. If you get enrolled in senior care and then don't want to be part of Advantage going forward, once you're enrolled in senior care, you will be able to opt out, and you will have to opt out. The next one is a welfare fund benefit. One of the current senior care plan in the optional benefits rider has two parts, only one of which CSA members pay for. The big part is the prescription drug benefit, which this year is $150.30 per person. The other is a extended hospital benefit, the 365-day hospital rider. For the last 21 years plus, the welfare fund has paid that for all CSA retiree welfare fund participants. When we did that originally 20 years ago, it allowed those who may have had a spouse or partner who had retired from the financial industry that had, at that point, they gave retirees health benefits too. The drug plan was a better plan, had lower copays. They wanted to use the partner or spouse's drug plan, but didn't want to give up the hospital benefit. So to avoid people paying $200 for a $2 benefit, we agreed with the city that we would pay that for our participants. We will continue to do that for those who are in senior care. I've confirmed it with the director of the employee benefits plan. She says nothing's going to change, and we will continue to pay that for you. As a result, if you decide that you want to remain in senior care, the cost to you will be $191.57 per person per month. Those of you who have friends or partners who are in other unions, maybe UFT, CUNY, uniforms, their unions do not pay the hospital benefit for them. So they'll be paying an additional $2.83 a month for that extended hospital benefit. The other cost, no matter which plan you're in, is the cost of the prescription drug benefit. And that cost is $125 per person per month. That will come out of your pension, and that is a reduction compared to what it is now, which is $150.30. Those opting out to a non-senior care plan continue to pay a premium. The OLR website, which you can get through our website, has all of the current pension deductions. And also, the last thing here is important. If you look through the pension deductions, you look through the other plans that are available. This is your last chance to enroll in one of those plans. If by chance you decide, I don't want to be in senior care, I don't want to be in Medicare Advantage, I want to be in the Empire Medicare related plan, which is also a Medicare Advantage plan and limits you to only Blue Cross providers, then you need to use your once in a lifetime option to change now and then opt out once you've made the change. So you have to use your once in a lifetime, this month during October, and then in November opt out. So this is where we are. Let me also mention that this is a citywide program. It's being implemented for all municipal retirees. It's not just CSA or UFT or CUNY or whatever. It's for everybody. It does apply to all retirees. So that's what I wanted to go through. And so now what I'm going to do, as I said, is I'm going to start going through the questions here in the chat. And, I saw a couple of good ones there when I was looking through them before. The first one here, how many New York City unions are in the plan? Every one of them. And it's not just unions. This is also those who are in management positions. So anybody who is retired from the city of New York will be, and Medicare eligible, will be put into this plan automatically unless they want to opt out. So it's not just we're not just picking on educators or anybody. It's for everybody, all city retirees. Question regarding prescription plan. Covered by your husband's prescription plan, which is part of FEP, we addressed that. And so you should have no problem using the spouse's drug plan. You can drop out of the Advantage plan and save the $125. Question, what forms are needed if you want to keep Emblem Senior Care? As I said, the opt-out form, it would be in the pre-enrollment guide that was mailed to everybody beginning on September 7th. If you haven't got it yet, there's two reasons. One, the post office is even slower now than it has been for many years. Or B, you moved and you didn't tell us so we could tell the city. And they also don't send it priority mail or first class, so those take a little longer. By now, you should have received it. If you didn't, it is on our website, csawf.org, and everything you need is there. If you need it mailed, we can print it and mail it to you. So, question of what's not in the plan. I really don't know how to answer that. This plan, the new plan, is designed specific for City of New York retirees and was designed to parallel the existing senior care plan as close as possible within the Medicare framework, Medicare Advantage framework, so that we being the city and unions could leverage Medicare's subsidy of these plans. So you'll see that there are a number of new benefits that may not be of interest to you, but they're of interest to somebody, I'm sure. One of the benefits that people have been asking for years is Silver Sneakers. And Silver Sneakers is a subsidized exercise program, gym membership. And it's available to those who are in a Medicare Advantage plan. Those of our retirees who are in the HIP VIP plan are eligible to be in Silver Sneakers. Those in GHI Senior Care, it wasn't available. That is now available, as part of the plan provided by the city. A fitness tracker, I don't know which one, I don't know what it looks like. Something like a Fitbit, that is also going to be available to you. Knowing that the subsidy from Medicare is increased with positive outcomes for illnesses and treatments, one of the benefits that's new in this plan is delivery of healthy meals if you've been hospitalized. The theory and the research shows that if you're released from a hospital and if you're very mature, because we never call anybody around here old, if you're mature, if you're living alone, and you can't properly cook healthy, nutritious meals, for a number of days after you're released from the hospital, they will have those meals delivered to you, because proper nutrition is one of the keys to a quick and successful recovery. Knowing that at some point it'll be difficult to get back and forth to a doctor or a pharmacy, you can arrange for, I believe it's 24 one-way trips to doctor visits or to pharmacy to pick up medications. that, and then use the welfare fund benefit of $2,500 for transportation beyond that. There's additional hearing aid benefits in there, an extra $500 which you could use every third year when you need a hearing aid to do that. So there's a lot of other things in there, and this is all rolled in, and this now becomes the free health plan. New York City is obligated to provide active, in-service, and retired employees free basic health care as long as they live for themselves and their eligible dependents. So the city has negotiated with the Alliance a new plan which will cost the city less, and this now becomes the benchmark plan. So if you go into the Medicare Advantage plan, the only cost is a prescription benefit. If you want to keep what you already have, you pay the $191.57 on top of the $125. This plan, the question here, how does this work for those in New Jersey? It's going to work the exact same way, because this is not a New York or a geographical restricted plan. This plan is good anywhere in the United States. So if you're a snowbird and you're in New York in the summer and you're in Florida in the winter, then you can have doctors in both places and you can use the plan in both places. If you decide that you want to be a halfback, it'll work too. You know, halfbacks are people that went to Florida and then came halfway back to New York and settled in the Carolinas. So you can be a fullback, a snowbird, or a halfback, or a fullback, or whatever. No matter where you are in the country, you can use the plan. Most Medicare Advantage plans that are being thrown up as comparisons are very restrictive in their geographical areas. HIP, for example, is basically good in New York and New Jersey. If you go to Florida half the year, then you're basically without coverage when you're in Florida or Arizona or wherever you may go. The senior care option we talked about. Do we have to register for the plan? Does a spouse have to register? If you're covered by the city now in senior care and you have your spouse on your plan as well, then you will automatically be in the Medicare Advantage plan. If you want to opt out, both you and your spouse would have to opt out. And if the only way your spouse has coverage through the city is by wisely being married to you, then whatever you decide works for the spouse as well. You can't have a non-city retiree spouse have a different plan than the city retiree spouse. So whatever the city retiree does decides what happens. It took this long to get this question here. I'm surprised. Does Aetna suing the unions in the city affect all the plans for the new program? I have no way of knowing because there have been no decisions yet. Aetna, my first reaction when I saw that Aetna was suing the city was what took them so long. But then when I realized that they started legal action within a week afterwards, I figured, okay, that's about right. I expected whichever company of the four initial ones didn't get it, that there would be some kind of legal action because it's too big a deal for them to pass up. There was a court session Monday afternoon. I do not know the results of that. I asked for an update, but didn't get it. We're proceeding now as if everything is on board, everything is fine, everybody's working for a January 1st implementation. If something happens along the way, then we have to adjust. And if there's a restraining order or an injunction or something, then we have to pause and then we'll take guidance from whatever the city decides that we're going to do. Because we have to work, and we'll work with them to make it as, what's the right word? Easy, not easy isn't the right word, painless maybe as possible. Do you have to apply for Part D if you go into Advantage? No. The prescription drug benefit for all New York City health plans is considered credible coverage for Medicare. So whatever drug plan you're in meets Part D's requirements. If you're fortunate enough to qualify for the IRMA deductions from your Social Security, you'll also see one there for Part D. That's not a drug plan. That's you helping to subsidize your own drug plans. Medicare is always looking for a way to have somebody help pay for things. So with the Affordable Care Act, they put in the IRMA on Part D. Unfortunately, the city is not in a giving mood, so there's no plans and has been no talk about getting that reimbursed. However, with the new plan, they will be continuing to reimburse in full for members and their eligible covered dependents, the Medicare Part B premium, both the standard and the IRMA. I'll try at the end to go into the website, but if you go to our website, which is www.csawf.org, you'll see the banner there. You'll see my picture. God help you. There'll be some text describing who we are, and scroll down, and there'll be a heading that says important links. And right under that, on the home page, are the pre-enrollment guides, the opt-out form, the frequently asked questions, the initial letter from President Mark Cannizzaro and myself, and other emails that we have sent that will be there. They're there for you to see. If you have problems finding them, let me know, and I can help you find where that is. Okay, how much will it cost? We talked about this. It's $191.57 a month to remain in senior care. No matter which plan you're in, you'll have the $125 for the prescription drug benefit. But if you go into senior care, it'll be $191.57 out of your pension every month per person. What are the cost differences between standard Medicare and Medicare Advantage plan? I guess maybe that's the pension deduction we just talked about. Oh, yeah, the most important thing I forgot to say. Question is, have Sloan Kettering and Hospital for Special Surgery joined the new plan yet? Found out late yesterday afternoon that Sloan Kettering had just signed a contract with the network and with the plan. So all of the Memorial Sloan Kettering facilities and their providers are available in the Medicare Advantage plan. And I, of course, had to ask the people from the Alliance, when do you expect to have special surgery? And they said probably within a week. So as soon as we know that that is done, we will let everybody know, because I know that these are two big concerns. I do not expect that special surgery will not come along, because in the pre-Medicare world, with the GHI CBP plan, both Sloan and special surgery have been designated as centers of excellence. So non-Medicare and active employees who need their services, either the cancer services from Sloan or the orthopedic services from special surgery, are directed and steered, if you will, to those two facilities to get top-notch care. So there is an existing relationship between the two groups and the city and our insurance plans, and so we expect those who will, we expect them to come along. Is this a meeting for those who did or did not attend the previous meeting? It's just a current update of what's going on. If you weren't able to participate in the session the Alliance did back on August 31st, that is also on our website, www.csawf.org. It's available there. You can watch it as many times as you want. 1,700 and something of your colleagues have already viewed it. Surprisingly, I guess maybe because I wasn't the featured speaker, some have watched it multiple times. And so we put it there so that anybody can see it. And though some people are so into this, they've seen it, they saw that Alliance presentation from 2 or 3 people, different organizations, and thought that ours was the most useful because we had provided them a list of questions that you all submitted before the session so they could address our concerns right up front as part of their presentation. So, okay, this is a good one here. Somebody says, if I opt out of the new health plan and keep HIP VIP, can you change to the new plan in the future? If you don't opt out and keep the plan, can you change back to HIP in the future? The answer to that is this is your last chance to be in HIP. If you opt out of HIP now, you can never go back. They're going to close all the other plans that they offer are going to be closed to new enrollment. Even if you age into the plan because you're in a HIP HMO pre-Medicare, when you become Medicare eligible, you'll be put in the Advantage plan. So if you're happy with HIP VIP, you want to stay in it, you need to opt out now. If down the road you say, you know, I've had it with HIP VIP, know that you can't go back to it later on. So it'll be a one and done decision if you leave one of the other plans to go into the Advantage plan. Okay, the deadline for opting out of Medicare Advantage is October 31st. I wouldn't wait till then. There's a number of places where you can submit the opt-out form. I'm partial, even though they're slower than molasses uphill in the winter. I would be inclined to do it by mail, but I would do it with some way that I knew that it got delivered. So at a minimum, I would send it certified with a return receipt. Hopefully somebody will send the receipt back. In the old days, the postman had somebody when they delivered the mail sign the little green card. I can't tell you how many little green cards end up on my desk with IRMA forms because they just throw all the mail on the desk. So I sign them and send them back. The more probably successful, but also more expensive way would be to do it by priority mail. You do a priority mail with the tracking, you can track and you can see when it finally gets to somebody. And when you have that tracking report, if by chance they don't follow your wishes and give you the opt-out, you can show them the tracking that says, look, you know, you got it on such and such a day, you know, it's your fault you lost it, you know, put me back in senior care. If you do it by fax, make sure wherever you're sending the fax from, if you're doing it from home, make sure you do a transmittal report that shows it says, okay, the fax went through. If you go to a Staples or a FedEx store or something, make sure you get their transmittal report just so you have proof that it went through. People say they send me faxes, I never get them. So this is a way to make sure that the fax was sent. If you do it by email, then make sure that you look and do some research with whatever email program you're using and make sure that you get both a delivery receipt and a read receipt. What the delivery receipt does is say that the server where you've sent the form has received the email. It doesn't tell you anybody opened it, but just that it's there. And then the read receipt says that somebody actually opened and read it. So both of those would be useful to do that. I'm surprised they're doing it by phone. That would be my least popular way to do it. And if you do it online, you know, I don't know if there's a confirmation, but anything that would be done online, it would say, thank you for submitting whatever, do a screenshot of that just to make sure you have it. Okay, somebody has Empire Drug and Medical right now, then you would need to opt out and remain in the current plan. And the opt-out form you need is the non-senior care opt-out form, which again is on our website. Here's a good question. How does the city save money and provide increased benefits? What are you giving up? The city is saving money because they've structured this plan within the guideworks of Medicare Advantage. And in any Medicare Advantage plan, the federal government through Medicare subsidizes the cost of the benefits to a very great extent. So if you got somebody else paying for some of the benefits, then you're not paying for those benefits. Medicare Advantage, to try to get more people into those plans, adds the additional benefits. And in the scope of things, a free gym membership is not a lot. If you compare the cost of a free gym membership to a hip replacement because you fell and fractured your hip and need to have it replaced, the gym membership is a great investment. I'll invest with those odds any day. The other part of the question is, what are you giving up? You're really not giving up anything. The only thing you're giving up is to be able to get any test anytime you want for whatever reason. And there's no reason to do those tests unless you're the doctor and you're afraid of malpractice. You know, the one area that they're going to be having some approvals on upfront rather than after the fact like it is now is what they call advanced diagnostic tests, which are MRIs, CT scans, and PET scans primarily. And so what happens now is the doctor says, Doug, you need a CAT scan. I go in, I get the CAT scan, and Medicare after the fact looks at it and says, why'd you have him do a CAT scan? He didn't need that. We're not going to pay for it. So now the provider of the CAT scan is left holding the bag. They don't get paid for that procedure. They could come after me, but they choose not to because they know I'd badmouth them and they'd never get any more business. So they eat those costs. What will happen now is the doctor says, Doug, you need a CAT scan. They'll put in the approval and the clinical guidelines say he doesn't need a CAT scan and it'll be denied. Or there'll be more information provided. If your medical condition warrants these tests, you're going to get the test. And also, there are no approvals if it's in an emergency setting. So if, God forbid, my wife has me in the emergency room on a Saturday night, my speech is slurred from something other than too many vodkas, and I've got numbness in the extremities, they're not going to wait 3 days to do a CT scan to see if I'm having a stroke. They're going to do it right there on the spot. And that procedure will be covered because that's proper medical procedures for treating the symptoms. So, you know, that's the only thing that I can see. I've looked at this for a while, and that's the only thing that you're giving up is just being able to have nobody tell you you can't have a test. And if there is ground for the test, if it's debatable, you can always appeal, and we will help you do the appeal because we want to support you and make sure that you get proper care. Why you have to opt out of what you have rather than opting into something new? The city has decided that the new plan will become the free plan that they were obligated by the New York City law to provide. So they're going to enroll everybody in that plan because that's their obligation. And as is currently the case, you have the option to opt out and be in a different plan if you want to. So that's why they're doing it in that fashion. And it's a one-time choice. If you opt out this year to stay in senior care, you can be a senior care as long as you want to. You know, it's not like you have to opt out of the Advantage every year. If you opt into Advantage and you're happy with it, then you don't have to say, I want to stay in this every year. It'll continue working in that way. Okay, somebody here says the doctors say that they won't take the new plan. If they're part of a larger network that is going to take the plan, then they will be taking the plan. But in the worst case, the doctors may say, okay, you know, we'll submit the bill for the Medicare, but you got to pay us the 20%. If that's the case, you pay the doctor the 20% and you get the statement from them. You submit that to the Alliance plan and they will pay you up to the full amount of the Medicare allowable charge. So you are covered. There's a little wrinkle, it's a little inconvenient, but you will be covered as long as the doctor takes Medicare, either accepts Medicare as payment in full or participates with Medicare. If you get a doctor that says, I want nothing to do with Medicare at all, I don't take Medicare, you want to see me, you're gonna pay whatever I charge. Then no plan is gonna help you. So if you go to one of those doctors and they charge $700 for an office visit, where the Medicare allowable is $100, you're paying the full $700 out of your pocket with no recourse. It doesn't count towards any out-of-pocket maximum. No, there's no reimbursement for it. You're paying that full $700. Okay. Again, if you didn't receive the package, send me an email. I'll put the email in here in a little bit. And then we'll get that package out to you. Is prior authorization required? Like I said, only under very few cases. More importantly, another thing that Medicare Advantage plans are typically criticized over is needing a referral for everything. With this plan, you can go to any specialist you want. It doesn't have to be a network or this, a network that, or with this group or that group. You can go to any specialist you want. All you'll pay is the $15 copay. So nobody's saying you can't go to this cardiologist you've gone to for 20 years because they're not participating. You can go to that cardiologist. So you still have control over your healthcare. Somebody wants to know who's speaking. I'm Doug Hathaway, Ministry of Your Welfare Fund. Specialists have advised patients to remain with Medicare, concerned over being able to get costly tests covered. We addressed that. Doctors are going to want to be, if I'm a medical doctor, not a doctor of sociology, I'm going to want the least restrictions on me possible. So they're going to want traditional Medicare where anything I do will get paid. Anything they want to get paid anyway, as long as it makes sense. Because it's not like somebody's sitting there and saying, Doug, you've had three CAT scans this year, you can't have one for another 6 years. They're going to say, what's your medical condition? What are they trying to diagnose? And yes, a CAT scan is a proper procedure, so it's approved. Let's see. Get the list of contacted service providers in Broward County, Florida. If you call the 833 number that's with the materials, they can help you find the providers. Those of you who have sent me providers that you want to know, a lot of them were in Florida, Tampa, and South Florida, the various networks. What was one? University of Miami Network and a couple of others. I have asked the Alliance for that. They have not got back to me yet. I'm going to bug them again tomorrow because I have more to ask them. As soon as we get a reply back, I know who asked me. If it's a network, a cancer network or something in some area, then we'll put it on a list and send it to everybody so that we'll know that. Medicare gives you 20 visits for acupuncture. If you need more, well, we help. We have been for the last 4 or 5 years providing an acupuncture benefit. It's my understanding, I may be wrong, but my understanding is that Medicare usually only covers the acupuncture for like lower back pain. We don't have any such restriction. So if Medicare says they're not going to pay anymore for the lower back pain, you have up to 36 visits that the welfare fund will reimburse you. We put $100 allowable charge on the visit, and then we will reimburse 80% of that. The retiree chapter, hopefully you're all members of the retiree chapter. The retiree chapter will add another 20% of what we reimburse. So for every $100 you spend, you'll get 96 back, up to 36 visits a year. We will need a itemized receipt showing the code and description and charge. And your first visit, we need a copy of the provider's state license, or if you're in the state where they don't license acupuncturists, their accreditation. We do this not to be pains. We want to make sure that you have proper care. And if somebody is sticking stainless steel needles in my body, I want to make sure they know what they're doing. So, so that's why we have those restrictions on the acupuncture. Okay, if you move outside the country, you can only be, you'll be covered for emergency services through the new plan. You know, that's pretty much now. Very few routine medical things come through, but it will be covered in an emergency setting through the new plan. Can the questions be printed? I don't know of any way to print these, unfortunately. I'll have to look into that. Okay, the guide says if you decide not to take any Part D, you may be subject to higher costs in the future. Please explain. The day you turn 65 or the month you turn 65 and you're eligible for Medicare, you must be covered by a qualified Part D prescription drug benefit. All of the plans you get through the city of New York meet that requirement. If by chance you are not covered by a prescription drug benefit, Medicare can penalize you 1% a month for every month that you were not covered going forward. So if you, for some reason, you know, you don't use a lot of medications, whatever, who knows, we're not covered for 5 years, then your prescription costs would go up by 60% because that's 60 months and it's 1% a month for 60 months. So you know, that's the higher cost in the future. So you do need to be covered by a prescription drug benefit. Is Presbyterian and Weill Cornell in the plan? To the best of my knowledge, they are. We'll put that, we will get clarification for that one. Again, with Brevard County, I guess Florida's on here again. Okay, what is the enhanced drug plan exactly? Asthma medication is very expensive. Basically, the plan, they call it an enhanced Part D plan because there is no deductible. With the drug plan, both for senior care and for the Advantage plan, your cost is 25% of the drug cost until you exceed the out-of-pocket maximum, which is called TROOP, T-R-O-O-P, which in government speak means true out-of-pocket. So in 2022, the TROOP, or true out-of-pocket, will be $7,050. This year, 2021, is $6,550. Once you get to that level, the cost drop down to 5% if it's one of the expensive medications, or like $3.70 if you're on the generic. What the plan does, and this goes back now for about 10, 11 years since the Affordable Care Act, is that when they were negotiating the Affordable Care Act, the prescription industry was first in line to say, we'll make some concessions, leave us alone, don't set drug prices. So what they do is, when you're, after you're in the first phase, when you're in what used to be the donut hole, where with our plan, it used to be 60%, and then a stripped down plan, it was 100%. When you're in that level, the drug manufacturers subsidize the cost. So when Medicare looks to see if you've exceeded the $7,050, they look at what you paid and what others paid. So if you look at your monthly report from Express Scripts, there should be 4 columns. The cost of the drug, what the plan paid, what you paid, and what others paid. So the what you paid and the others paid go towards that out-of-pocket maximum. So you technically are not spending $7,050 out of pocket before you get into what they call catastrophic. You're spending quite a bit less than that. And depending upon the medication, you can be out of the donut hole, and then the catastrophic point as early as April, May, or June. And some medications are very expensive. The other thing, this came up with a member the other day, that you see advertised on TV, take this medication, it's zero copay, right? Use the coupon, sign up for the member assistance. That only works for pre-Medicare people, but they don't say that on TV. And I haven't been able to get a pair of glasses that will let me read the fine print quick enough to see on the bottom if they say it doesn't apply for Medicare. Because if you're covered by a Medicare drug plan, you can't use the coupons. Because Medicare figures that if there's two drugs that treat a condition, one's a very expensive brand name medication that has a coupon and one isn't so expensive, by using the coupon that reduces your cost, you're going to go with the more expensive medication because of the advertising. So they say no coupons for that. If you know somebody who might be on Medicaid, they can't use the coupons either, because that artificially they feel drives people to use more expensive medications. So one thing that the industry does to help people, of course, they won't let us use. Okay, we did the drug plan. I can't comment on this one. The question is, why is TSA not joined with the UFT and others in retaining a lawyer and suing the city over the inferior plan? We can't comment on the Aetna lawsuit. We don't think that it's an inferior plan. If the unions in New York City thought that this was an inferior plan, they would not have been in favor of it, because guess what? Every single union president, whether there's 125 of them or 150 of them or whatever, at some point in time, they're going to be retirees, and they're going to be Medicare eligible retirees, and they're going to be put in the Medicare Advantage plan. So they're always looking out for themselves, like we all are. And that's all I should say on that. How do you get insulin paid for? Insulin, you pay the 25% copay. What the insulin savings plan program does is limit your member cost share to $35 a month. And that's why it would be a godsend for a lot of city retirees, our members, UFT CUNY members, but also some of those who are on much lower pensions. And we will continue to push them to include that. Okay, the doctors are not part of the networks. Again, if you will send me those doctors, and I think I have sent your doctors over to the Alliance, if there are others, let me know, and we'll have them contacted and try to get them to be part of the network. If somebody wants to know the dental and vision options, the dental and vision options in the new plan are add-ons. The dental, I haven't looked at them in detail. I've been more concerned with, some of the basic, the medical and the testing and all. But I do know that these plans typically, if they're offering a dental benefit, it's a very minimal dental benefit. It could be 2 exams and 2 cleanings a year, on the plan if you go to a participating provider. You currently have, through the Retiree Welfare Fund, 2 exams and 4 cleanings a year. Also with these plans, if you need anything, even a filling, it'll be a minimum 50% copay. And again, with the participating providers and with the extended network, with the MetroDent and the Carrington networks, you pay a lot less than 50% for some of these procedures. The vision, I haven't looked at that yet, quite frankly, I'm sorry. But typically it's, maybe a simple eye exam and a very minimal amount, $50 towards a pair of glasses. It may be able to be used with our benefit between the welfare fund and the chapter. Why would you want to opt out of the Advantage plan? Good question. people who want to opt out of the Advantage plan are maybe scared by having it called Advantage. Yeah, I joke and say if they could have called it Medicare Premier, we wouldn't be here today because everybody'd say, "Ooh, I'm going to have a Medicare Premier plan. Look at me." But those who find it offensive or don't want to be bothered or have be worried that a test is denied would be those who would opt out. And if you do opt out, you're free to do it, and it'll cost you $191.57 per person per month. How is the city expected to save money if not by rationing care? And we've talked about that. With the subsidies, there's also a couple of factors built in. There's what they call a star rating, where Medicare looks at the health outcomes of participants and also looks at participant satisfaction with the plan. And the higher the star rating, the more money Medicare kicks in. And the cost to the city is locked in for 5 years. So, you know, we have this for the 5 years. If you opt out, would the cost be the regular GHI payment plus the opt-out fee? If the regular payment you're talking about is the cost for the prescription drug benefit, yes. But what you're paying now, the $150 will drop down to $125. October 31st is the end of the opt-out. September 15th to October 31st. Prescriptions. If you're in the senior care plan now with the prescription drug benefit, then it's the exact same drug plan you've known and loathed for all these many years. There's no change in the plan. It's still the 25%. It's still pretty much the same formulary, which is set by Medicare, and you know, so it works the same way. Yeah, you do not have a mandatory mail. You can send things into the mail if you want to, but all Medicare participants can receive up to 90 days at a local pharmacy without mandatory mail. If you turn 65 next year, do you opt out now? No. If you turn 65 next year, you'll be put into the Advantage plan when you turn 65, and then can opt out at the end of the year for 2023. Okay, we just entered that one again. Opt-out deadline, October 31st, received or postmarked. I'm guessing postmarked, but if you know by, say the middle of October that you're inclined to opt out, I would do it then. Sort of like the commercials for mailing your Christmas gifts, avoid the rush, do it now. It is going, I think, by mail to the West Coast somewhere for initial processing. Is there outreach to doctors? Yes, provider outreach has been going since the plan was approved on July 14th. They have a whole team working on this, working with the networks, working with providers. When they offered to contact those providers that we gave them, I indicated that they should expect a deluge of requests. And they said, don't worry, we'll add staff. So they're committed to contacting everybody that you give us. And I'm hoping that I can get it back from them that they've been contacted and what the result is here in the next couple of weeks. So yeah, if you accept the Advantage plan, you must use the drug plan from the city. You can't be in another drug plan. We've helped a number of other people over the years who have very expensive medications, even at 25% copay, to drop the GHI drug plan and then go use get another drug plan that is less expensive and has lower copays. If you're in the Advantage plan, you can't do that. you must use the plan, the drug plan that comes with it. If you opt out and remain in senior care, then you can purchase your own drug plan as long as that's a compatible Medicare Part D plan. What happens if you want to remain in standard Medicare with the $15 deductible? I think you mean copay, be subtracted from the 20%. That's true. The 15, you know, if the charge for, if the 20% is $3, you're not paying $15, you're paying $3. So it's up to $15 for the copay. The premium, there is no premium to be in Medicare Advantage. You still pay the Medicare Part A and B. Well, A you don't pay for, you pay the Part B. The city will continue to reimburse in full Part B and the IRMA, so that's coming back to you like it always did. And if you're in the Advantage plan, your costs go down by $25 a month to $125 per person instead of the current $150. What is the plan Empire Anthem on the price list? Email me. I don't understand what price list you're talking about. If you're talking about the rate sheet effective January 1st of 2022, it's listed as Medicare Advantage for Medicare, and it's all the way over to the right, the last one on the right, for the current plan, and then GHI is listed as GHI Senior Care. So, we've got some young folks here, guys. This is great. My wife and I are 60 and 61. Do we need to opt in once we become eligible? What's a non-senior plan? A non-senior plan is what you're in now. It's called GHI CBP. And when you become Medicare eligible in 4 or 5 years from now, then you'll be put into the Medicare Advantage plan initially, and then at the next transfer period, you can switch to senior care if you want. The Advantage plan is going to become the automatic plan for those who retire, even if you're in something other than GHI CBP pre-Medicare. You'll be enrolled in the Medicare Advantage when you turn 65. Oh, here we go. Okay, a comment here about the Post article that's brought by 4,000 retirees suing to block the new inferior Medicare coverage. Yeah, I don't agree that it's inferior. If you look at some of the backgrounds, and particularly this 4,000 retiree organization is what was created on Facebook a month ago, and if you look a little bit more, you can get a better feel for those behind this. The feeling of the city, of the MLC, and its constituent unions is that this is not an inferior plan, and what was achieved through collective bargaining and over years of work and all was that the city would provide for all active and retired members or employees and their eligible dependents a free basic health plan. It didn't guarantee that it was going to be senior care. It didn't guarantee that it was going to be HIP VIP. It said that there would be a free basic health plan. The way the health plan has been managed in the city of New York is probably unique, because nothing can be done to the health plan unless management in the form of the City Office of Labor Relations and the workers in the form of the Municipal Labor Committee agree to make those changes. So the city can't just come in and say, everybody's going to pay or everybody's going to not get Medicare anymore. This has to be negotiated and worked out. And what we have here is, again, a bargained solution to benefit everybody, to enable the city to continue to provide the free basic health care. My husband is Medicare eligible. I'm not, only 61. What's it mean for you? I don't know what last chance means, but so for the person who is Medicare eligible, that person will be in the Medicare Advantage plan unless you opt out. The one who is not Medicare eligible has no change in the health plan. It'll still be GHI CBP. So your coverage will be GHI CBP no matter what. If your husband wants to opt out of Medicare Advantage, it's going to cost you out of your pension $191.57 for him to do so. So in jest, I say make sure he takes you out to dinner somewhere nice once a month. If you agree for the Advantage plan, you have to apply. No, the application is automatically. How does the police union rejection of Advantage affect the educated retirees? It doesn't affect us at all. The plan is implemented for all city retirees, unionized, non-unionized, and applies to everybody. And the majority of the member unions of the Municipal Labor Committee approved the plan. So if the police union, the PBA, or whoever, whichever one it is, doesn't approve, short of them now buying a Medicare Advantage plan and pulling their employees out and doing everything, their members will be covered by this in the same way. If you're in the current plan, all diagnostic testing require approval. If you're in the current senior care program, there is no approval for diagnostic testing, but everything will also require a $15 copay. Both plans will have a $15 copay. The senior care plan, if you go to a primary care or internist, that will have a $15 copay. If you're in the Medicare Advantage, there is no copay on primary care visits. What's being done to make providers aware of the changes? The folks from the Alliance, they have a whole division of people that are working on provider education, and they're doing it in a variety of ways. Webinars, emails, phone calls, text messages. It's one thing, you've got to put the information in front of somebody, but then you have to make sure or try to find a way to make sure that they actually read it and look at it. And it may not be the doctor who's the one making the decision. It may be a billing clerk or somebody. So this is ongoing. Again, let me know what kind of doctors that you're concerned with. If you have specific providers that you rely on, we'll have them contacted. And hopefully we'll get an answer back as to what the result is. Once you're enrolled in the plan, there'll be information for the fitness tracker. I don't know what they're going to do or which one it is yet. If you move to the Advantage plan, can you keep welfare fund, hospital rider, and prescription drug plan? We provide neither of those. If you're in senior care, we pay the city for your hospital benefit. All welfare fund benefits are going to continue as they always have been. Once you get to be Medicare eligible and in the senior care or now the Advantage plan, rather than reimbursing copays, we'll give you $40 a month for every month that one of you was in the Medicare drug plan with GHI at the following year. That's the Valentine's Day check that you get every February. If you're a long time and very mature, you get $480. If you turn 65 or your spouse turns 65 ahead of you during the year, it's prorated to the number of months somebody was Medicare. And that will be continuing. That's not paying for the medications, they're helping you pay for the cost of the prescription drug benefit. If you accept the Advantage plan and opt out of the drug plan, you can't enroll in any other kind of drug plan unless it's a TRICARE plan unless it's a spouse's New York State drug plan. You can't go buy a United Healthcare or an AARP drug plan and be in Advantage. If you opt out of Medicare Advantage to stay in senior care, you can opt out of the GHI drug plan and you can be in any drug plan you want. The providers have a deadline to let the plan know if they're going to participate. I'm not aware of any, but there could be. We'll see if we can find out. Somebody here, 5 unions voted no on the new plan. Why didn't CSA vote no? CSA didn't vote no because we weren't opposed to this. We were interested in continuing to provide quality, free basic health care to all New York City retirees, and also doing so in a way that would protect other benefits and other protections that retirees have. The reason that retirees have free basic health care in the city of New York, and only in the city of New York out of the entire United States of America, is because the New York City Charter, basically the Constitution of New York City, says in the charter that the city of New York is obligated to provide free basic health care to all active and retired employees and their eligible dependents. It's not inconceivable. Remember, it was just a couple of 3 years ago that New York State wanted to open its constitution. And there was a massive campaign to defeat the referendum on the November ballot that would create a constitutional convention. Because if you open up a document such as the state constitution or the city charter for revision, because you want to get rid of one thing, there's no telling what else could be taken away. There may be something they could do. So that I haven't read the charter, but there may be something in there to do with pensions. And maybe that would be taken away too. So anything we can do to preserve what we have without opening a Pandora's box was a decision to make. And there were 5 unions that voted no. Some of them have deep political reasons to vote against it. Some others didn't. And I don't recall offhand which 5 they were, but there were 5 out of either 152 or 125 that voted no. So the overwhelming majority of unions in the city of New York approved of this and support this. Are most doctors accepting it? There's 650,000 doctors in the country that are part of the extended Blue Cross network, and they're all accepting it. And we're working now on the other 200,000, we being the alliance. Will the deductible be $203.22? I don't know. I haven't seen the figures yet. They usually come out in October, mid-October. So whatever it goes to, if it goes from 203 to 205, then the total deductible for the new plan and also for senior care will be $255, the 205 Medicare and the $50 plan. Somebody has a December birthday. You turn 65 in December. So for 1 month, you'll be in senior care. And then unless you tell them in December you want to be you want to stay in senior care, they'll put you in the Advantage plan beginning January. Question here from the spouse of a member the spouse is a veteran. Can you opt out of just the drug plan? No. If you opt out, whatever happened, the member controls things. So if the member is in the drug plan, then the spouse must also be in the drug plan. If the spouse doesn't want to be in the drug plan and wants a different Medicare supplement, fine. But the only way to get reimbursed for the Medicare Part B premiums is to be covered by the city of New York. Is the plan good if you live in Florida? It's good anywhere in the country. Tell us about Anthem Health. Okay. Gotta take a drink for that one, sorry. From my Empire Blue Cross water bottle. Anthem Health is the parent company of Empire Blue Cross and Blue Shield. There are a number of Blue Cross Blue Shield plans around the country. In New Jersey, they call themselves Horizon Blue Cross. In Buffalo, it's Blue Cross of Western New York. In Michigan, it was Michigan Blue. So there's this group of Blue Cross Blue Shield insurance companies around the country, and they're affiliated. So that if you're in Florida and need to go to the hospital, you show them the Empire Blue Cross card, and Empire ends up paying the bill, even though you're in Florida. So Anthem is the parent of a number of these Blue Crosses. And as a result, Anthem has put together a network from among all of these constituent local Blue Crosses of about 650,000 providers. And that is the underlying network for this. Empire is our local point of contact, and Empire has access to anything that Anthem has. Dental and vision are going to continue to be covered by the welfare fund. There will be some supplemental coverage through the plan. We still need to figure out what's going on with that. Aetna's suing the city. The bid wasn't even reviewed. That's incorrect. Aetna's bid was reviewed. Aetna's bid was reviewed and negotiated equally. For weeks, we were being told we're on the best and final, another best and final, another best and final. They were going back and forth with both of the two finalists to try to fine tune and build in benefits that mirrored what we have in senior care. Like I said before, I don't know the results of any lawsuits. We're working as if everything is full speed ahead. If something is done in the courts that pauses things or stop things, then we have no choice, but we have to adjust what we're doing, and we'll let everybody know what's going on. But for now, it's an open enrollment period through the end of October and an implementation date of January 1st. Infusions, there may be a $15 copay with infusions. Most infusions, or basically all infusions, are Medicare Part B procedures. So you're going to a facility for that, and there would be a $15 copay for that. And that will be in both plans, senior care and Medicare Advantage. You take a very expensive drug each month. You'll continue to need the drug no matter what plan you have, yes. And it will continue to be, you'll continue to pay 25% of the cost of the drug. If a medical group is in network, will all doctors in that practice accept it? Yes, they do. Again, somebody's turning 65 in December, congratulations. If you turn 65 in December, you don't do an opt-out now, but once you turn 65, then you do the opt-out. And if you want to get, in that case, if you get it to us, we'll get it to the city and make sure, or get it to me rather, and I'll make sure they get it and they honor your request. What items that were provided will be included in the Medicare Advantage? There's nothing excluded. Whatever you got now in senior care, you're going to get with Medicare Advantage. You're getting more with the Advantage. My wife is a city worker from a different union, which is fine. Both retired, you continue to enroll separately. Yes, we recommend that. The reason being is, in fact, I'm working with someone now. They were both city retirees, had the coverage under her name. She passed away, and we're now working with the city and Emblem to get coverage reinstated in his name. Because when they recorded that she had passed away, they didn't think to look and say, well, what about the spouse? So we're working now. So it makes things a lot easier. And this way also, if you each keep your own plan, one of you can opt in, one of you can opt out, and then see how it works if you want. somebody has a condition that can be removed under standard Medicare, it might be considered cosmetic. I can't comment on individual. I'd have to, we'd have to have the full medical records, and it would have to go to the plan. I wish I could tell you. Can you keep all the same doctors and specialists? Yes, as long as they take Medicare. How will the prior approval work? Who will make the decision? The decisions are made according to published clinical guidelines by Medicare. It's not some bean counter somewhere saying, nope, that's one, we've had enough CAT scans this month. And as long as there's a medical necessity for the test that fits established published guidelines, the test will be approved. And like I said, very rarely do you need a test the same day that it's that they give it to you. If it is, they can put it through as an emergency, and because it's an emergency, it'll get approved. But most tests, other than in an emergency room, my experience has been you've got to wait a week or so to get a test scheduled anyway, which is more than enough time to get the approval. Again, we're waiting for information on my University of Miami Health. That was one of the first ones we sent in. Will CSA pay for the wife, non-CSA retiree 365-day hospital rider as well? If your wife is on your health plan, is your dependent, we will pay the 365-day hospital rider. If your wife is a, let's say, what are the odds, a UFT member and has her own coverage, then we're not paying her hospital rider. We're only paying it for members and their eligible dependents who are identified as CSA retirees. Can the spouse of a city retiree have different than the city retiree? Only if they're both city retirees. If the spouse only gets city coverage because they're married to the retiree, and whatever the retiree decides, the spouse has to have the same. Okay, we talked about MSK. That's been updated. Express Scripts, yes, they're still using Express Scripts. It'll be based, it's the same plan that you have now. We talked about Sloan and special surgery. The doctors who don't know about it, why isn't it being advertised? There's no point in putting an ad on TV because the doctors aren't watching the same channels you are. There are webinars, there's emails, there's video programs going on to the provider networks, to the providers, and in the media and the sources that they look at, targeted to them, and individual calls are being made as well. Not eligible yet for Medicare, God bless you, I'm jealous. And it will be automatically enrolled in Medicare Advantage when you do turn 65. If you winter in New York, if you summer in New York and winter in Mexico, if you're in Mexico and have an emergency situation, then that'll be covered and reimbursed. But if it's a routine visit, you're going to be on your own, pretty much the way you are now with senior care. Okay, if the city retiree is 65, but the non-city retiree is 65, city retiree is not yet 65. The non-Medicare retirees in CBP, and the city retirees and one of the Medicare supplement plans. Got a note here, United Healthcare sued also. I had heard that. I haven't seen the filing yet. But if United Healthcare has filed suit, you can expect the fourth company, which was Humana, to be right behind them. United Healthcare and Humana were knocked out in the first round of submission, and Aetna and the Alliance survived to the end. Does the Alliance plan offer COBRA if you predeceased the spouse? Yes. You've got the 3 years of COBRA. That's federal regulations. At whatever the rate is. I haven't seen COBRA rates for January of 22 yet, but then we'll have an idea of what the true cost of the plan is. Because with COBRA, you pay what the employer pays, or in this case, what the city pays for the plan, plus 2%, because the Advantage plan would then have to bill and collect premiums from you. Express Scripts we talked about, seamless, hopefully, but I don't know about you. I've yet to find a way to make it seem completely smooth. So there will be a few wrinkles and bumps. Everybody's ID card for the new plan will have a dedicated phone number that you or the provider can call, talk to a real person, and get things straightened out. This is one thing the Emblem has excelled in the last few years. Part of this latest healthcare saving effort was that anybody who's newly hired to work for the city of New York, no matter what position, has to be in the HIP HMO for 1 year. And in doing so, they put a lot of money into member services and enrollment support and all. And they're running, after a year, they can switch to another plan if they want. And the retention rate is in the mid-90s, like 96, 97%, who have agreed to remain in HIP when they can get out. So a lot has been put in up front to ensure a positive experience, but from personal experience, I'll let you know that nothing is ever smooth, completely smooth. Okay, husband has WellCare for prescription. If you want to stay with WellCare, then you have to opt out of the Medicare Advantage plan, stay in senior care, and opt out of the drug plan with senior care, and then be in WellCare. So if you want to maintain the WellCare plan, it's going to cost you $191.57 per person to be in senior care. The home health agency, I have to do some more digging on that. I do apologize. But if you send me an email, I'll do some digging and let everybody know. We have our own home health aid benefit, and that's what we've relied on for many years, for at least 15 or 16 years. And so I have to find out a little bit more about that. You want to get, I don't know if there is a list of contracted service providers in any area. If you call the 833 number that was with the enrollment materials, they can tell you who's participating, who's not. Understand that the underlying network is 650,000 providers, and that would be a very big book if one would ever print it or ever try to download a list. And my personal experience is that whatever list or whatever book you have that lists providers is obsolete and outdated the day you have it, because providers opt in and out of networks on a daily basis. And so somebody could be participating in September. You want to make an appointment tomorrow, they could say, oh, I stopped participating in that plan on September 30th. So on October 1st, you're out of luck. Question about IRMA. As long as you're in a New York City Medicare supplemental plan, senior care, Advantage, HIP, whatever, you'll be reimbursed for IRMA and the standard for Part B. They do not reimburse IRMA for Part D, only Part B and the IRMA for B. So if you're in senior care, you get the reimbursement. If you're in the Medicare Advantage, you get the reimbursement. If you're in HIP, you get the reimbursement. Somebody says the doctor won't take the Advantage plan. All doctors will can take it. If they don't want to take it, then we can have them have the Alliance contact them. Again, they don't know about this plan, how it's different from the traditional Medicare Advantage plans. So yeah, send me their name and we'll have the Alliance contact them. Columbia Presbyterian, I believe they are on the network, but we will verify that. If you want to return to senior care after being in the Advantage plan, will there be a problem getting it? No. Will there be a higher cost? The cost is probably going to be adjusted every year. What they do for the plans that are not the free the baseline benchmark plan is they look at the claims experience for that people in that plan and figure out how much more it costs than what the other one was. And so that's how they came up with 191.57. So if the experience of those who opt out of Advantage to stay in senior care in 2022, if they're the very sick people, then the city pays more for that, and as a result, the pension deduction will go up. If by chance those who opt out are the healthy people, and the claims experience that drops, then it'll be less than 191. And the actuaries, there's actuaries and consultants that work for the city, and there's another group who work with the MLC. They work together and come up and help establish the reliable costs. So it's not one side trying to sandbag the other. It's a cooperative effort. What percentage are taking the plan? I do not know. New York Eye and Ear, I don't know. If you send me an email, I'll find out about them. I believe they are, but I don't want to lie to you. If you opt out this year to remain in HIP VIP, that's fine. If you ever decide to give up HIP and go into the new plan, there's no way to get back into HIP. HIP and all the other plans are being frozen to new enrollments after January 1st of 2022. Moffitt Cancer Center is on the list. Advent is on the list that we submitted to the Alliance. A specialist who accepts Medicare won't join the plan. If you must go to that provider, you'll pay the provider the Medicare allowable amount, submit it to the Alliance plan, and they will reimburse you. You never received the pre-enrollment or opt-out forms. UFT friends got theirs. One of two reasons. If you moved recently and didn't inform the city, they didn't know. Or you've got horrible mail service. Like I said, they're on our website, csawf.org, and they're available there for you to review. Yeah, if you're in senior care, you continue to pay Part B and IRMA, and the city does reimburse you. If you're in COBRA now with senior care, that's where you're going to be. This is only for those who are, New York City retirees. Your spouse has been dead for 2.5 years. So when the 3 years is up, you'll need to find another Medicare supplement. It doesn't have to be one from Emblem Health. If you contact us, we will be more than happy to help you figure out what makes sense, what's affordable, what provides decent coverage, and make sure that you get properly enrolled. Expedited for pre-authorization, I'm sure there is. We're being told it's usually a couple of days to get the approvals done. A friend told me that we'll have to be pre-approved for specialists by a primary care. True or false? No. There are no approvals. There are no referrals to see any specialist. You can go to any specialist you want to. You can go for a second opinion if you want. You can pick whoever you want to go to for a primary care. You can go to a specialist. They can do something that annoys you, like go on vacation to Israel without telling you that you need to reschedule your appointment. And show up and they say, oh no, didn't we tell you? No. And then, you can go pick a different specialist. So it's not like, oh, you got to be referred to somebody. You have total choice of which doctors you want to use. Again, I don't know the percentage. They will take a return receipt at a PO box, as well as you can do it by priority mail to a post office box. I've done it with the IRS. Yes, we go back and forth each year between Advantage and Senior Care. NYU Langone is part of the plan. Again, opt-out form is on our website, and it's also in the book they mailed you. Our website is csawf.org. Am I staying in or opting out? Interesting question. I'm not eligible. I am not a city retiree. I was never a city employee. I am here because I am hired help, and I'm an employee of the welfare fund. However, and this will be reviewed thousands of times, this is my personal opinion. This is not welfare fund opinion. This is not CSA opinion. This is not MLC opinion. But from what I know, if I were eligible to enroll in the Advantage plan, I would do so. I would have my wife enroll with me. And if I wasn't happy at the end of the year, I would go to Senior Care like everybody else can, but I would certainly give it a try, because there's a lot of things in there that are going to be beneficial to me. And I would certainly give it a try. There's nothing I see there that I find objectionable enough to have to pay $400 a month for what I can get for free. Now, everybody as long as you're covered by a City of New York Medicare supplemental health plan, you are entitled to be reimbursed for Medicare Part B and for IRMA. So there's no, if it's not specific to Senior Care or anything, it's not specific to any union. It's for all retired New York City employees, whether they're unionized or management. No, if you want to continue with the prescription drugs, if you are in the drug plan now with Senior Care, just opt out and they'll keep you in the drug plan. If you're going to stay in the Advantage plan, you'll be there with the drug plan. Concerned with the authorization procedures, if that's the deciding factor, then probably opt out and see how it works out. Is there a significant advantage to staying in the old plan rather than going into the new plan? Probably not. There's probably more of an advantage to going into the new plan. Both plans will have co-pays on them beginning in 2022. Co-pays for this existing Senior Care plan was supposed to be implemented January 1st of this year. But between the combination of the success of negotiations for the new plan, plus the lingering effects of the COVID pandemic and people not being in offices and all, the decision was made to defer co-pays for a year so that they went in at the same time that the new plan did. So it's like, rather than rip a Band-Aid off a wound twice, we're just doing it once and they're making a nice big pull. So both plans will have the co-pays. With the Advantage plan, your out-of-pocket costs, the combination of the Medicare deductible, the plan deductible, and the co-pays will be limited to $1,470 per person. With the Senior Care plan, there is no cap, and the Senior Care plan also has co-pays on primary care. You don't need gap insurance, Medigap insurance with the new plan. It basically is Medicare and the supplemental plan together. No, your commitment to the new Advantage plan is a one-year commitment. You need to, if you decide to give it a try, you're in it for the year 2022. If when the transfer period comes in the fall of 2022, you say, Doug, I gotta get out of here, this is the worst thing I ever did, then you can do so. You can go back into Senior Care, no penalty. You'll just pay whatever the increased premium is. The providers, you'll have to contact the alliance there. The 15 copay, yes, each test, each procedure. Each test in the sense of once per blood draw, once per sample collection, not for each test they run on the sample. You don't have to opt out. Once you opt out, you're good to go. You don't have to do it every year. You just have to make sure if it's for a drug plan, you have to make sure you're in that drug plan. Do they have a deadline? I'm not sure if there's a deadline for providers. The husband has been in Medicare with gap insurance for many years. If this is non-city coverage, then you can keep it. He just doesn't get the Part B reimbursement. If you're referring to city coverage, then whatever you do, if you're the member, he would do the same. If you're in the Advantage plan, it's advisable to have any extra plan. You really don't need any extra plan. The only thing you might have is the catastrophic from like Waller, Seabury Smith, Marsh, Mercer, whoever. If you have that, keep it. It's got additional home health aids and benefits if you're in a nursing home, and it'll help with the prescription drug, your out-of-pocket costs before the welfare fund can do it. So out of that $7,000, depending upon which plan you have, you can get a lot of that back if you have that Mercer plan. Do you retain Silver Script's prescription plan with Advantage? If you're in a Silver Script plan now, that's not the GHI prescription plan. So if you want to retain that plan, you'd have to opt out of Advantage and stay with Senior Care, or drop the Silver Scripts plan and use the GHI plan associated with the Advantage plan. The only RX benefit is the optional benefit you pay for, and you get that automatically. For some reason, they continue to list it as an optional benefit. Again, I don't know the percentage. If you opt out, you can only opt out into Senior Care if that's what you're in now, unless you use your once in a lifetime benefit and switch to something else and then opt out to keep in that benefit. Does the vision care cover checkups on cataracts with an ophthalmologist? Again, shoot me an email. I'll double check and see what's going on with that. If you're going to be in the Advantage plan, you'll get new cards in December. It'll be one card instead of the 3 that you have now. And there'll be a dedicated phone number on there for providers or you to call if there are any issues getting it accepted. Chiropractors, to the extent Medicare covers them, will be covered by the plan. We talked about outside the country. To keep your current drug plan, if you opt out of Medicare Advantage, you'll keep to be in Senior Care, you'll keep the Senior Care drug plan. If you live outside the United States and have a heart attack, will all services be covered? Send me an email, I'll verify. My understanding is that that would be considered an emergency situation, and any out-of-pocket costs you had would be reimbursed. If you opt out to existing Senior Care, you're still in GHI CBP. CBP is the pre-Medicare plan. Senior Care is the Medicare eligible plan. How will the drug plan handle a level 5 drug? The same way it does now. So whatever you're doing, whatever's happening now, will happen with the same with the new plan. It's basically the same drug plan. Let's see, what else we got? Veteran with the drug plan through the VA. Yeah, you can opt out of the drug plan and do that. Question is, you indicate you have a spouse who's the member. If your spouse can also participate in the VA drug benefit, then they can just drop the drug plan and use the VA for both of you. But if you want to drop you and she wants to stay in, or your spouse wants to stay in the Advantage, then you'd have to be in the Advantage too. We can't split coverage within the family unit. Now, my comment about the city's not in a giving mood and we're not getting Irma, My comment was the city's not in a giving mood, so they're not going to be reimbursing Medicare Part D. The city is obligated by their prior agreement back when Medicare was first implemented to reimburse for Medicare eligible retirees and their dependents covered by the city to reimburse in full the Medicare Part B premiums. So that's what they're obligated to do. The IRMA for Part D, they're not obligated to do, and that's what I meant when I said that they're not in a giving mood because they're not going to be reimbursing that. Welfare fund benefits remain the same. You're still covered with SIDS for dental and our extended networks with Carrington and MetroDent. How does Anthem compare with Emblem? I don't know on what basis we could compare them. Anthem is the parent company of Empire and a number of other Blue Crosses, and as such, Emblem is a regional insurance company that's the parent of GHI and HIP. Okay, somebody, it takes a very expensive prescription, has never paid anything out of pocket. I'd like to talk to you. We need to see what the funding source of that is. It'll cost $191.57 a month to opt out of Medicare Advantage and keep GHI Senior Care as your Medicare supplement. That's on top of whatever your Medicare Part B premiums are. Okay, I know the welfare fund does not provide a prescription drug benefit for retirees, so that the only way to get a prescription benefit is through the health plan. Doug, let's see, turn 65, I'll be automatically put in Advantage without my approval. Means my husband will be opted out and I won't. Shoot me an email, remind me, and I'll clarify your situation. Because I know there's some interesting things there. Is there a way to have a consultation? We can probably work out something, but there's 6,000 of you and there's one of me. But if you give me some times, we can try to arrange something. A cost chart for prescription drugs. I don't know what we're referring there. In terms of the cost, what you can do is, if you haven't been in this prescription plan before, take a look at the monthly reports you get from whatever prescription plan you're in now. And in the first column where it says, cost of the drug, multiply that by 25%, and that'll be your cost. OCLI Vision, I'm sure they are, but shoot me an email, we'll verify. If a retiree's left New York City, withdrew from all New York City health plans, now has Aetna Advantage, will he be able to be in the new map? If you withdrew from all New York City health plans, that means you waived all coverage, and this Aetna Advantage plan is something you picked up somewhere else. If that's the case, then what you would have to do is apply to reinstate your benefits with the city with a health benefits application form that's on our website with an effective date, probably January 1st, and then you can be in the Advantage plan. I'm not aware of any hospitals that won't accept this. Do we have any extra staff to answer individual questions? We have 5 people here who have been doing nothing but answering Medicare Advantage questions for the last 7 months on top of me. So if you call, you can talk to somebody in the staff. Call 212-962-6061 between 8:30 and say 4 o'clock. Somebody, if nobody's available, somebody will give you a call back. If you really stump the expert, they'll refer you to me, and then we can figure out what's going on. We talked about TRICARE. This is the good one, and I don't know how to reply. I'll read the question first. It says, during 2022, will you have Zoom updates to keep us informed about implementation problems, issues, and take questions? I'm just hoping to get to the end of October and get to the end of the opt-out period, because I know as soon as December hits, we'll be getting calls on December 1st. Where's my ID card? So we will probably do, I'll make an effort to do this periodically. And also, if you are a member of one of the retiree units, I speak with them at their meetings frequently, and can use that as a forum as well. Okay, we talked about the cost. I don't know the time frame for ordering the transportation, and I don't believe it can be denied. They give you X number of visits. Usually want 2 or 3 days notice so they can get it scheduled, and and then work that way. We'll have to see how that gets implemented. Somebody's confused. A free plan, you have to pay $125 a month. The basic plan is free, and the city has always had people pay extra for the prescription drug benefit, whether you're an active employee or a retiree. And so that's just been their policy. That's why for the active members, we've provided a prescription drug benefit, and you will get it as a rider to the retiree plans. See what else we got here. Again, MD Anderson in Texas, send me an email because I'm not writing the stuff down right now. I'm sure they are. They're, I believe, the largest healthcare facility in the country, so I'm sure they're involved. Does a welfare fund offer transportation? We offer, non-emergency ambulance and ambulance services. We reimburse up to $2,500 a year for that. Telemedicine, video visits are still covered. Premiums for the health plan are deducted from your pension. The Medicare Part B is deducted from Social Security. And when you have to, could your primary care be your cardiologist? Yes, mine is. When I was pre-Medicare, he always billed me the primary care specialty, not the cardiology specialty. Yes. So if you're currently in a different drug plan, you have the option to have that either pay them directly or you get a ticket from Social Security. You would have to disenroll from Silver Scripts. They would stop the deduction from Social Security check, and then the pension deduction would kick in. Yeah, the dialysis would be three visits, $315. And that's where the Advantage plan would help, because it's going to limit those costs to $1,470. If you stay in senior care, it's what's that, $45 times 50 weeks. So you're getting up there in terms of just on that one service. If eye injections for macular degeneration, if they're covered now, they'll be covered by the new plan. My mother-in-law had a very restrictive Medicare Advantage plan, and she had those injections regularly and only had her copay. So this plan will certainly cover those. We talked about opting out now. This is a PPO. It's not an HMO. And it's definitely a PPO. So when you talk to your doctors, let them know that that's what it is. Receive a booklet from Medicare Advantage listing all the benefits. That's what was mailed to everybody. It's also on our website. Once you are enrolled, they'll be sending you more information, such as how to enroll in the silver sneakers, how to get the fitness tracker and all of that. Oh, somebody, thank goodness for Port St. Lucie. Everybody's participating. That's great. Yes, you keep SIDS for the new plan. Nothing changes there. SIDS and our extended networks of Metrodent and Carrington are still available for you and your eligible dependents. How do you convince doctors in Puerto Rico it's a Medicare plan? Get us the names of those providers. I'll get it to the Alliance and then they will contact them for us. Prescription reimbursement for HIP VIP. Because HIP drug plan is different than GHI's, we actually continue to reimburse copays for that. So you would just send us a report at the end of the year and then we can reimburse those. Walk-in facilities, City MD, those will be covered. And any problem returning to the senior care, if you don't like it, no. There won't be any problems getting, going back and forth. The city is committed to that. Okay, we did that. The CSA Welfare Fund cover payments to non-Medicare doctors. In a very limited situation, if you have a doctor who says, I don't want anything to do with Medicare, if you want my services, then you're going to pay whatever I charge. If you go to a provider such as that, what we will do is look at the procedure that was done, take the Medicare allowable procedure for that, take 25% of the Medicare allowable procedure as what we consider allowable, and apply that to our $1,000 catastrophic deductible. So you've got to have a lot of very expensive procedures, or one really huge non-covered procedure by a non-Medicare doctor in order to get anything back. That's done by design because we're not in the business of paying claims on a primary basis to a doctor that doesn't want to be like everybody else and be part of Medicare. But in a rare case where that's what's needed, then we can provide some minimal assistance with that. Personal disadvantages. I don't know everybody's personal situation with medications. We'd have to sit down individually. Is Duke part of it? I'm assuming Duke in North Carolina. I would believe so. We talked about the COBRA. We talked about non-Medicare doctors. If you predecease your husband, you're the member, can he be playing on the Medicare plan, Advantage plan? Yes, he'd be able to continue on the plan for 3 years under the COBRA provision. And I haven't seen what those rates are going to be yet because I don't know what the rates, what the cost is for next year. Okay, you know, again, somebody wants to know Cleveland Hospital. I'm not writing these down. I'm trying to get through. You know, I feel like the Roman guy in mythology that was pushing the rock up the hill, and as soon as he got to the top, he had another hill to go up. I keep going, and it keeps saying I got 193 messages. So this is like my worst nightmare when I was a cook. Shoot me an email and with any of these providers, and we'll go on to see if we can get them contacted. It's a local pharmacy. You know, you'll show the new Advantage card, and that will have the prescription information on it. Currently, you have a separate card for prescriptions. Oh, somebody likes me. Oh, good. Somebody had problems getting a prescription from Optum. You know, shoot me an email. I don't know why it's going through Optum. Somebody's in Tampa. Send me an email and we'll figure out what, because I don't want to take up the time. I'm getting confused with that. Is there a political guideline to determine if you need a test? I have no idea what that means. Everybody gets, if your medical condition warrants a test, then you can get the test. How do you calculate what you're paying now for healthcare? You have a pension deduction on your pension stub. It's $150.30 a month per person. That's for your drug benefit and whatever you're paying for Medicare Parts B and D through the IRMA. That's what you're paying for healthcare. The 191.57 is not reimbursable. No. Northwell, NYU, and Maimonides, I believe they're all part of the plan. How long will 15 last before it's raised? I have no idea. If I knew that, I'd go bet on the numbers tonight and retire. If you're using the husband state plan, I would probably opt out of the prescription plan of the Advantage if you're going into the Advantage, just to make sure, just to be safe. The address of the Alliance is on the materials they sent, or if you didn't get it, it's on our website. Will the city offer dental and vision in conjunction? No, the city doesn't offer any of that. That's all provided by union welfare funds. So our dental and vision will continue. Thank you. What's the advantage of the Advantage Care over standard Medicare? Well, in terms of your city coverage, if you stay with traditional Medicare and the senior care plan, it'll cost you $191.57 a month per person, and there's no cap on what your out-of-pocket costs will be. If you go with the Advantage plan, the basic plan costs you nothing, and there's a cap of $1,470 on your out-of-pocket costs. And is Part B reimbursement payable retroactive to date of enrollment? Within limits, they'll go back 3 years. So if you haven't been getting the Part B reimbursement, scan and email me a copy of your Medicare card. We'll archive it here, and then we'll send it over to the city. And at some point in the future, you'll get whatever is due. And then going forward, you'll get the previous year's money in April. So in April of 2022, you'll get 12 times $148.50 a month, which I haven't done the math yet. But it's probably around $1,800. It'll show up in the account. You get your pension in probably the 3rd Friday of April, and then you can apply for the IRMA. We did that. Opt out of Medicare Advantage Plus, correct? Yeah, you would opt out of Advantage Plus and stay with the current plan. Preventive care and screening is covered according to Medicare guidelines. Yes. Okay. What's the once-in-a-lifetime benefit? It's not a once-in-a-lifetime benefit. It's a once-in-a-lifetime opportunity to change your health plan immediately and not wait for the next transfer period. So if you wanted to, let's say, go into the Empire Medicare related plan, where you pay something for the basic coverage, you pay something for the prescription benefit, the only way you could do that would be to file a health benefits application now with the city saying, beginning November 1st, or November 1st we could do it for. November 1st, put me in the Empire Medicare related health plan. And they would do that. And they say, okay, Doug, you've used your once in a lifetime. And then you would, if you wanted to continue in that next year, you then immediately do an opt-out form that says, I want to keep my Empire Medicare related plan going forward. And so that's the once in a lifetime option. Can you access the recording later? Yes, I'm going to post it on the website. I think I did it right this time so that there's not a lot of editing. But we will post it on the website. And when I send it put it on the website, I'll send everybody an email. Drug plan is going to be the same. GHI CBP is pre-Medicare, senior care is Medicare. Seeing if there's anything new here, because I've kept you here long enough. Will doctors be reimbursed less for their services under this plan? No. At the end of the day, between Medicare, the plan payment, your copay, the doctor gets the full Medicare allowed amount for all services, just like they do now. But for the doctors, they'll get one payment instead of two. Doctors now submit a claim to Medicare. They get paid the 80% by Medicare. When Medicare pays the claim, they electronically send the information to your secondary, which is either Empire or GHI. Then they take a while, they process the claim, and then they send the doctor money. So there's a time lag between getting the 80% and the 20%. With the plan going forward, there's one point of contact, one payment. So they'll actually get money quicker with a new plan. Let's see. We don't cover, no, the welfare fund doesn't cover prescriptions. And you've got the website there. RX reimbursement for out of pocket over 5,000. It's actually whatever the out of pocket maximum is for that year. So in 2021, the out of pocket maximum is $6,550. So if you actually physically spend more than that, we can reimburse up to 5,000. And for next year, for 2022, that amount will be $7,050. Yes, we still need hard copy because we need to see the full report. Because what those reports do is once you meet what they think is the out-of-pocket amount, they don't keep updating. So the summary doesn't give us the information we need. Unfortunately, we need copies of every month. Okay, Okay, we talked about that. Again, somebody, if you have HIP VIP, if you want to go into the new Medicare Advantage plan, you do nothing, you'll automatically be enrolled. Somebody says they're going to be paying $475 for Medicare Part B per month. Will you get all that back? Yes. If it's for Medicare Part B, you get all of that back. If you want to keep traditional Medicare and senior care, you only have to opt out the once. You don't have to do that every time. Yeah, it's a one-time thing now at the beginning as they're implementing the plan. Is there a deductible for the HIP prescription plan? I really don't remember. I should know that. Shoot me an email and I'll verify for you. Somebody's asking if you're unhappy with the Advantage plan in March, can you go back to senior care? I believe it's a one-year commitment, so you'd have to wait out until the end of the year. What happened? It all of a sudden disappeared? Wow. Oh, it was showing me 210 messages. Now it's showing 1. Oh. And it's a thank you. How about that? That's great. Okay. I thank you for your time. I thank you for your patience in dealing with the chat and not being able to speak, but with upwards of 300-400 people, it wouldn't have worked. So I thank you. Again, if you continue to have questions, I'll send everybody an email when this gets posted. Hopefully it can be done by tomorrow, but I'm tied up tomorrow afternoon with the Manhattan retirees doing the same presentation. And maybe over the weekend I can get it up and online. If you missed it or you want to see it all over again, just go back and register for next Wednesday session. That's at 11 o'clock in the morning. I did this one in the afternoon for those of our retirees who are out on the West Coast or somewhere could participate without getting up in the dark. And so now I'm going to stop the recording. I'm going to stop talking.